As a former product manager at Google, I'm often asked how I think about the difference between being a product manager there and a digital health firm such as Verily, where I've been working. I can speak to what I saw myself directly as a PM leader at Verily and what I learned as I built up our product teams there. My simplest answer, and I'm biased, is that Google and technology have a really great role defined in the product manager. And my goal has been to be that kind of a PM in digital health and to create great PMs like these who are great PMs like an Amazon, a Google, pick your favorite tech startup, but who also have deep healthcare knowledge and intuition about that space, that ecosystem, those products. My observed reality has been that for the most part, I've been able to find and hire great Google, Amazon, techie PM types, or I can find and hire great folks with clinical backgrounds, but it's less common to find someone with both. If you're one of those people, congratulations, we can't find enough of you. Go apply to your favorite healthcare startup. They want you yesterday. So my experience at Verily is that I put the time into both hiring and thoughtfully educating techie product manager types, while also hiring a meaningful fraction of folks with healthcare backgrounds, and then bringing them along to be Google-style PMs. Like, how does a Google PM work? How does that machine work? Stepping back, I think being a product manager in digital health is very much like being a product manager at Google. You have to be passionate about the product, have intuition about how to build a great product. You have to work hard to figure out the jobs to be done, build a roadmap, and so on. But it's harder because the knowledge space is deeper. You need to understand clinicians, you need to understand a complex industry, probably one of the most complex industries in the country, and the ecosystem around it. And further, you're likely trying to build a scalable, sustainable business, so you need to have a knowledge of the regulatory reimbursement. Like, how am I actually going to sell and make money doing this thing, this great idea that I or my company have? And there aren't easy answers like freemium, software as a service. None of those easy answers that tech PMs often lean on apply in healthcare. So, long story short, it's the same but harder. And did I mention the timescales are often longer, especially if you're partnering with those players in the ecosystem and trying to change how healthcare works? So harder and takes longer, but the same job. And the last thing I would add is it's far more meaningful, right? I often interview people who have been in healthcare. They've left healthcare for some period of time for various reasons, sometimes saying it takes too long to do things. And then they come back because even though it takes a long time to drive change, the change you drive matters. The things you do save lives, help people live healthier, better lives. And that's really powerful. So harder and better,